Welcome everyone, and we're gonna talk about that in our clinic. We're putting all things together with science and also the integrate with energy medicine. And what we are doing is we use the neuro-organizational technique and acupuncture and classical laser and stem wave therapy. And all this therapy is I've been doing this one for 24 years based on all the clinical result and approaches, and also is for the complete the health. Today we're gonna go over that what is the loop. Loop is related to the fascia. Then we're gonna talk about that one, and also talk about the classical laser, and also what we can do for help that to increase our outcome. A lot of chronic pain, people who have arthritis and neck pain and knee pain and joints and all those things is related to that our muscle and joint and the tendon and ligament is not working properly, and they are like all the stiff and also the inflamed and swollen and all those things. And from the beginning, why they get the stiff and the tightness and the inflammation and getting arthritis is because of their energy flow in our body. Energy flow to the joint is like blocked, so the area of the cells of the joints not getting enough the supply of the energy and blood flow. When our energy, just like the have electricity go through the send the energy, and we have an energy channel in our body, and our energy channel not working like supposed to be, then also we have stress. Body could store a lot of stress and fatigue and tired, and also our posture become getting really like unbalanced, and also a lot of our body function become very unstable. So because that with the poor posture and the joint is not enough getting the energies the circulation, and how we walk when we don't know, but we walk like crooked, and but if we keep going like that, it affects the other joints and starting to have arthritis, and we have a joint pain. When we have a pain and other health problem, then we go to see other doctor, and what we're getting is we have the diagnosis of a headache, and we get a headache medicine. We have a diagnosis of that pain, joint pain. We get pain medicine, but those can help. Maybe can help relieve temporarily the pain, but it doesn't help that the underlying cause of the issue. So even if we don't feel the pain, then the underlying cause of issues keep going, progressing. Just like when we are, if our the teeth is having a problem, and if you keep taking the pain medicine, but what's going on in the gum and the teeth is keep going into the further problem, but we don't know if we keep taking the medicine. I will be talking about the loop, and loop is the fascia connection from the pelvic floor, diaphragm, and we have another separating the fascia from the brain and to the neck. And all those things are supposed to be connect together and function, and a lot of our posture and also our the hormonal function and organ function, they are all connected. Nerve is connected to from all this the fascia, they're also connected to brain. So just like the brain turn the switch, and our body function of the body parts, the work when the switch is turned on and get connected, and is supposed to be working as the one unit. And one is like a tight, for example, I've seen many people who is a pelvic floor is very tight. That affects the female, male problems, and also the back pain, and also when the diaphragm is tight, that affects the digestion and the liver function and blood sugar and all those things can be connected, and also that can affect the heart and the breathing function and all those things. The main diaphragm is like the diaphragm is like one of the major, and also the pelvic floor is one of the major. Those things like many of the case, like one side is tight, that affects the pelvis to be rotated, and it affects our sacroiliac joint, and then sacroiliac joints, they're connected to those fascia, they're connected to our neck, and make our body twisted and affects the close to the neck, to the head. So that affects if those things are getting stiff, it can affect the headache, stiffness, and anxiety, and those things are pretty common. Through the fascia, our energy flows. So all the acupuncture point and acupuncture meridian, where the energy path and all those things is related to the fascia, and how acupuncture work is because of those points related to the acupuncture energy pathway. When we stimulate with the needle or acupressure, that improve the blood and energy circulation. Once the energy circulation is better, and that will the body heal itself. So when we release, like a lot of people who have a tight pelvic floor and the diaphragm, and also many people like in here, the neck and the brain is like tight, then what happens is like all those things is like one side is like tight and pulling the other side, and when those are finally like released and all the tension goes away, then like feel like very liberated and feel free, and blood circulation and start to circulate, and our pain start to disappear, and the body heal itself. In the C1 is that the first vertebrae of the neck, that those things is like they are connected, and also connected to posture, and also our energy. So those are like one of the like a switch. When those things is like crooked and tight and not aligned right, then it affects all our energy function of the body. So C1 is a very important. When those things are tight, those energy flow, it keep going and blocked in here, and when those circulation or energy is not complete, that will affect a lot of tension of the headache and all other symptoms. The pressure field is related to our breathing. When you most of the people who like energy is blocked and the posture is affected, when the posture is going forward and the neck is like going forward, then what happens is our breathing is very shallow. That when the breathing is shallow, then your energy you are like not recharging. Your body is like a cell phone, energy has to be recharged every day, but not being able to recharge and keep working, then your energy is like a drain, like a battery, and you feel like a very tired and fatigued, and those things could happen. That the laser, it can go penetrate all the way to the deep layer to the system, and so the good thing is can activate that with that touch the energy flow. So when those things, when we have like energy is like not building and stuck, and it's like tight area that needs to be the like circulation and like the blood, and class 4 laser can help to release the tension and get the blood flow get going and energy flow. And also the laser helps that produce the ATP, so it increase our the energy level, and also the increase of dopamine. So it'll feel like help us to relax and focus. Also that it decreases inflammation. So when the laser helps that when the joint is inflamed, and also the other body parts is inflamed, and it'll help you to decrease the inflammation. So it's good for the body circulation. So in the lower abdomen, we have there are several points. Is the energy of the C, it's a CV6 below the belly button, and in also the another point below to that the CV6 is a CV4, which is the gate of life in a point, and those things are related to a lot of related to the pelvic floor. So when those places like tight, then all the pelvic floor is like not functioning well. Then when we breathe, breathe, we cannot do breathe, and also to the abdomen, and also the function in that area of the lower abdomen, the energy flow, the holding the energy flow, it is like diminished. So when we those things are tight and diminish the energy in that pelvic flow in that lower abdomen area, is a pretty common, is related to the digestive issues, and also male and female hormone, and the sexual function, and the low back pain. Those are pretty common. The laser helps that increase the energy flow, and also the release of all the tension of the soft tissue in our body, so the energy circulation gets much better. So all those things what we can apply for clinically, and people who have a lot of chronic pain that it's been there for a while and tried everything and didn't work. It can help that the chronic pain, because of this therapy help that improve the energy circulation due to the removal the constriction, tightness, and the block related to the energy flow. And once the energy flow restored, then the body start to heal itself. And also any sports injuries, and also the people who wants to be have more energy and be healthy, that will help that, because increase our body function, and also the hormonal balance, and all those things is related to the fascia and connected to the nerve and brain. After all those things, the fascia is released, then the pain can be improved pretty quick in a time. And also I noticed that my patient posture improved quite a bit, and also their breathing is like before was very shallow breathe, and it'll help to breathe deeper. And once the breathe deeper in our body functions better. That is stress, and also our anxiety, and our brain function gets better. So it helps that improving the breathing and more relaxed. Treatments will help that improve the sleep, and because of the autonomic nervous system. When the fascia, the energy is blocked, and the roof is like not working as supposed to be, then what happens is that nervous system is like constricted, not in balance, to the more like tight mode. Then it's hard to sleep, because the supposed to be relaxed, tension has to be relaxed, and those things. So this will help you to improve the circulation and energy, and release tension, and also the sleep. And also it'll help that the range of motion, and also walk better with a much more balance, and the increase the shoulder range of motion, and also the back, neck. So once the more range of motion, then that will help that to release tension and get more blood flow. This will also help that vitality and health, because of body function related to how the energy flow to the body, from that lower abdomen to all the way to the brain, and has to be connected and circulating up and down. And then when those things what's supposed to be happen, and relax and get energy circulation from bottom to top, and come back and circulate, and our energy feels so much better. if you want to experience that how if the roof that our fascia and unlock that circulation, you can come now and call us and to try in the trial session. And once you do the therapy, and you'll notice quite a difference of your tension relief, and also the body tension decreases, and more energy. Thank you.